What if I told you there was technology that can guarantee the tallest, smartest, healthiest child possible? Okay, so there is this newer technology called PGT-P that's been making the headlines, promising to help you choose the embryo with the lowest risk of future diseases and even with certain traits. So let's talk what's real, what's hype, and why I, as a fertility doctor who routinely uses PGT-A and PGT-M in my high-volume clinical practice, do not recommend using PGT-P to my patients. PGT-A is pre-implantation genetic testing of embryos for aneuploidy. This is the most common test used as part of IVF. It allows us to identify an embryo with the right number of chromosomes, 46, allowing us to avoid the transfer of embryos that have missing or extra pieces of DNA that would be at a higher risk of not implanting or resulting in a miscarriage, or even a child with a condition like Down syndrome. Now, PGT-M for monogenic disorders is specifically for cases where you know you're a carrier of a certain genetic mutation and you're at risk of passing that on to future generations. So things like cystic fibrosis or even certain cancer predisposing mutations like BRCA. When I did IVF with my husband, we did carrier screening and we didn't match up for anything. I wasn't a carrier of any X-linked disorders. And given our lack of family history to suggest certain genetic diseases, we did not look to do PGT-M specifically. Now, PGT-P is very different. It's looking for polygenic risk testing, looking at genetic variants, tiny markers across the genome that are associated with complex diseases like diabetes, heart disease, schizophrenia, Alzheimer's, just to name a few examples. So PGT-P generates this risk score for each embryo for many diseases and traits that can arise. Most of these are multifactorial. They can arise because of genetic and environmental factors. So the claim is that this technology allows you to line up and compare all of your embryos, and then you can identify which one has the lowest combined future risk of all of these diseases, which sounds amazing. But here's the problem. These scores are based on data collected in large adult populations, actually mostly from European ancestry, and these are trained on adults, not validated in embryos. And in reality, there's not going to be any long-term information validating whether these predictions were right for at least 20 to 30 years from now at a minimum, because that's how long it would take for an embryo to implant, grow into an adult, and then actually have enough time pass to see if any of these chronic issues or diseases pop up. And that's assuming that there is even any sort of mechanism for tracking people born from embryos screened with PGT-P technology in long-term registries, which is highly doubtful. And what kind of risk difference are we talking? When you're comparing embryos, you're talking about marginal differences. You might be choosing one embryo with an estimated 10.3% lifetime risk of heart disease over another one with a 10.8% risk. That might be statistically detectable, but definitely not clinically meaningful. It misses the mark on the important questions like, will this embryo implant? Will the pregnancy be healthy? Will this child thrive? How is their lifestyle going to be? How will their environment influence the risk of these potential outcomes? Polygenic testing can't answer that, and it's not regulated. There are no formal guidelines, and none of the major reproductive societies recommend its use. This is being marketed to patients without robust scientific transparency or meaningful counseling. I do not recommend PGT-P, nor would I ever want to go back and use it on the embryos that I made as a patient doing IVF. And it's not because I'm against innovation or having extra information, but it's because innovation without validation is just speculation.